good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So, today we'll discuss about the parathyroid gland. So, basically, human beings are having the four parathyroid gland, which are situated on the posterior surface of upper and lower poles of thyroid gland. These are very small in size, usually about 6 mm long, 3 mm wide, and 2 mm thick, with dark brown color. They are made up of the chief cells and occipital cells, which secretes the parathormone, as shown in the figure also. So it is parathormone secreted by parathyroid gland, which is essential for the maintenance of blood calcium level in the body or in the blood, because calcium is an important inorganic ion for many functions in the body. So usually secreted by the chief cells of the parathyroid gland, and usually the hormone is having the protein nature, so usually 84 amino acids, and usually half life is 10 minutes, and normal level of the hormone is 1.5 to 5 mg per deciliter. It is usually 60 to 70% is degraded by the Kupffer cells of the liver, means by the process of proteolysis, and it play an important role in maintaining the blood calcium level, also the blood phosphate level. So the blood calcium level has to be maintained within the range from 9 to 11 mg per deciliter, because it is important for many body activities. So parathormone maintain the blood calcium level by acting on the bones, like it enhances the resorption of calcium, that is also by acting on osteoblast on kidneys. It helps in reabsorption of the calcium from renal tubules along with magnesium and hydrogen ions, and also it increases the formation of, we can say, 1,2,5 dihydroxycholecalciferol, which is the activated form of vitamin D from 25 hydroxycholecalciferol in kidneys. In the GI tract, absorption of calcium ion it increases, and formation of 1,2,5 dihydroxycholecalciferol in kidneys. So in turns, thus increase the absorption of calcium from gut. Also, vitamin D is very essential for calcium absorption from GI tract, but vitamin D itself is not active substance. Instead, vitamin D has to be converted to 1,2,5 dihydroxycholecalciferol in the kidneys and liver in the presence of parathormone. So it is the active product, we can say. So if there is low concentration, so basically how the body works. So if there is low calcium in the blood, then parathyroid gland release the parathormone, and then efflux of calcium from the bone, decreased loss of calcium in the urine, and then also it also increases absorption of calcium from the intestine, and thus in this way it increases the concentration of calcium in the blood. So how this activation of vitamin D? So there are various forms of vitamin D, but the most important in the body is vitamin D3, which is also known as cholecalciferol. So it is synthesized in the skin from 7-dehydrocholesterol by the action of the ultraviolet rays from the sun, and it is also obtained from dietary sources. So in this way, 7-dehydrocholesterol converts to cholecalciferol. Cholecalciferol vitamin D3 जो है, that is, so in the presence of sunlight, 7-dehydrocholesterol is converted to vitamin D3, and it occurs in the skin basically. And in liver, this cholecalciferol further converted to 2,5 hydroxycholecalciferol, and then in kidneys 1,2,5 dihydroxycholecalciferol, that is the active form of vitamin D3, that is converted by in the presence of the parathormone. And then again in the intestine, 1,2,5 dihydroxycholecalciferol calcium absorption increases. When calcium level increases, again parathormone then inhibits. So it also decreases the phosphate level by increasing its urinary excretion. Like along with calcium resorption, parathormone increase the phosphate absorption from the bones. Also in kidneys, phosphatoric action, which is the effect by which phosphate is excreted through urine. In the GI tract, it increases the absorption of phosphate. from the calcitriol. And in the parathormone receptors are of three types, 1 to 3, which are G protein coupled receptors. So they are, one is more physiological important. And how it is regulated. So main is regulation is very important. Like parathormone secretion is inversely proportional to blood calcium level. If it is low, then it will be secreted. High will not secrete it in the excess quantity of calcium in the diet, then it will not secrete it in the body. If there is increased vitamin D in the diet, then again, or if there is increased resorption of calcium, or we can say the blood level of phosphate, we can say secretion is directly proportional to blood phosphate level. So there is some applied physiology, like it could be hypoparathyroidism, like hypocalcemia can occur due to surgical removal, or we can say autoimmune disease or deficiency of receptors. So it could occur. So if hypocalcemia occurs, then it definitely hypoparathyroidism could lead to hypocalcemia. So definitely it results in tetany also. It is an abnormal condition in which there is violent and painful muscular spasm in feet and hand occurs. So there could be convulsions and there could be carpopedal spasm, that's the attitude of the hand as shown in this figure also. There could be laryngeal stridors, there could be cardiovascular changes, there could be latent tetani. There could be the neuromuscular hyperexcitability due to hypocalcemia. And hyperexcitability in these patients is detected by some signs like Trousseau sign, like spasm of hand after 3 minutes of arresting blood flow to lower arm. And there could be joystick sign, there could be herb sign. So these could be due to the hypoparathyroidism. Thank you.